Hi friends, this is Dr. Michelle Logging from Strength Within Physical Therapy and Wellness. So today I want to talk about a bit of a broad topic. I want to talk about eating disorders and physical therapy. When I first started working within the field of eating disorders, the question that I would often get is, well, why do patients with eating disorders need physical therapy? One of the things that I always like to think about is when we think about physical therapy, the bread and butter of physical therapy is typically working on recuperation, rehabilitation from an injury, like a knee injury, shoulder injury, whatever it is. And yes, that's definitely a part of the work that I do in relation to eating disorder pathology. Typically, when we're working on rehabilitating an injury with an individual that's also working on recovery from an eating disorder, it's an injury like an overuse injury. So perhaps they're participating in an excessive, and I'm air quoting that, an excessive amount of exercise, be it running, maybe weightlifting, what have you. And so we can work on the rehabilitation of that injury for sure. And there's the wonderful opportunity for us to begin that conversation about quantity of movement, the intent behind participating in the movement, and we can really start to discern what the relationship with movement is. Is it a healthy relationship or is it a dysfunctional relationship with movement? And so I feel as experts in movement dysfunction, we can also begin to have that conversation about how can we create a relationship with movement that is joyful, intentional. Can we do movement that is fun, that we really enjoy, we look forward to? And or is there a sense of obligation, a sense of shame or guilt, need to participate in movement? So we can begin to have those conversations with individuals that perhaps are on that spectrum of over-exercise, perhaps compulsive exercise. In addition, there's the opportunity for us to work with those individuals that may be not in the over-exercise, compulsive exercise category, but are maybe those individuals that are fearful of participating in movement. And perhaps they're fearful because they've been told not to do movement currently, and or they're afraid that starting back into some sort of movement will lead into that excessive compulsive exercise kind of habits. So we have that opportunity to work in both of those spectrums to help build in safe, intentional movement based on what is most appropriate for that person who is in front of us. And that's where I think kind of the art comes in, is to really begin to understand the person in front of you, what they're interested in, what they're curious about, what maybe some of the barriers are to accessing movement, and really having those very vulnerable, open conversations and allowing those conversations to happen at a pace that is safe and supportive for that person that you're working with. And so it's a little bit broader than what we typically think of as physical therapy, and in combination with other team members. So hopefully, in terms of when I'm working with eating disorder clients, typically there's a registered dietitian, a therapist, a medical doctor on board that is eating disorder informed and sensitive. And so I'm not working in a silo, I'm not working by myself. So really having that really great network of care to provide this net around the patient that we're working with, so that we can kind of see it from different perspectives and different angles to really support that patient as best we can. Because face it, movement/exercise, again, I use those words interchangeably, is a part of our life. One of the things I like to say is that our bodies are made to move. They're not only made to move, so we need to kind of find a balance for our patients/clients in that. And there's not a recipe per se in terms of how to find that. It's unique to each person that we work with. So hopefully that's helpful in understanding that connection between eating disorders and physical therapy. If I think of more, I'll make another video and share it with you. Thanks for watching.